Hey guys, Dr. St. Jean here. Thanks for tuning in. Today we're going to talk about how you can tell if your low back pain is caused by this condition called spondylolisthesis. Now, spondylolisthesis is nothing more than when a vertebrae in your spine starts to slip forward, right? So if you're thinking about your body, it's slipping forward towards your pelvis, towards your chest, or towards your throat, depending on the location of the slippage. Most commonly, it's the lumbar spine, okay? And that's why I drew this diagram like I did. You can see here, this is supposed to be your sacrum, which is below the lumbar spine, and then you have the lumbar spine, which makes up most of your low back. This vertebrae right here, your L5 vertebrae, the last one, is the one most commonly affected by spondylolisthesis. Now, you can see the whole vertebrae here is translating forward. That's essentially what this condition is. So the symptoms of spondylolisthesis are, some of them are, you'll see most of the time in patients. Patients will come in with this and you'll see a certain set of symptoms that happen almost every time. And then you'll see other symptoms that depend on the degree of slippage. So I'll explain that in a second. But most every time when a patient comes in with this condition, they're going to have really intense tightness and stiffness around the affected area of the slippage. They'll also often complain of the muscles in that area being really severely tender, just to even light touch. I know that if I even put my hand on there just a little bit, they'll jump off that table. In terms of the symptoms that can vary depending on the slippage, that would be like the radiation of the pain or the numbness and tingling. So you'll usually see with spondylolisthesis some radiation of pain in terms of sharp or burning or stabbing type pains, and then numbness and tingling. But the reason why it's variable is because if you notice here again from the diagram, this slippage of this vertebrae could potentially impact the spinal nerves coming out the side of the spine. Actually, I have a spinal model I'm going to grab so you can see what I'm talking about. This is the spinal model, right? If we're talking about the low back pain and the low back region in general that is affected by spondylolisthesis, you can see here these little nerves coming off the sides. Those are spinal nerves, right? And if one of these vertebrae started to slip forward, you could see how it would potentially affect this nerve. Now, the degree to which the slippage occurs will determine how intensely you'll experience radiating symptoms. That's basically what that is. So you'll also sometimes experience with spondylolisthesis some difficulty walking or some clumsiness in the lower extremity if there's motor abnormalities, if the portions of those spinal nerves coming off are affected with the motor fibers, right? So it just depends. So there's some variable symptoms, there's some ones that are pretty set in stone, but that's generally the presentation of someone suffering from this. This is a condition that afflicts mostly the lumbar spine, and the reason for that is because the lumbar spine holds so much of our load. It takes on so much compression from our day-to-day activities that it's going to be most commonly affected, and specifically, like I was saying before, the last lumbar vertebrae, L5, is the one that we're usually seeing this effect. There's also certain athletes that are at high risk for this, and that would be people that are playing hockey, football, Olympic weightlifting type activities, gymnasts, all at a higher risk for spondylolisthesis. So, we diagnose it with a really good, thorough history and, of course, an exam. And then we confirm the degree of slippage using imaging studies like X-ray and MRI. Now, you can, on a scale of 1 to 5, is how we grade the slippage. It depends, whether or not you're going to be able to use some of our natural therapies for this condition. If you have spondylolisthesis, there is a good chance that we can actually help you. But really what depends is the degree of slippage. If your slippage is too extreme, then you're most likely going to be a surgical candidate. So keep that in mind. I hope that this is kind of helpful and shed some light on what this condition is, and if you're experiencing some of these back pain symptoms, this might be spondylolisthesis. So what are you going to do? You're not going to sit there and try to treat yourself or diagnose yourself, you're going to go schedule an exam, whether that's with myself or someone else. You really want to get this taken care of. If you want more information on low back pain in general or spondylolisthesis, go ahead and click the link below to get to our video blog. If you want to work with myself one-on-one and get rid of this once and for all, go ahead and click the schedule a consult link, and I'll look forward to meeting you. This is Dr. St. Jean. I hope you found this helpful and useful. I'll see you next time. Bye-bye.